Thank you for joining me today. Today, I want to explain and teach schizophrenia. Schizophrenia is a bad disease. It affects social person's social contact. It affects financial. It affects mood. It affects any area of life function. So here is what you are going to expect in this video today. You will understand the biological basis and core features of schizophrenia and other psychiatric disorders. You will identify the key symptoms include hallucination, delusion, disorganized thoughts, and negative symptoms. You will recognize how schizophrenia affected cognition, perception, mood, emotion, behavior, and social function. We will review the risk factors, assessment strategy, diagnostic criteria, and explore management approaches and relapse prevention and associate psychiatric and medical comorbidity. Schizophrenia and other psychiatric disorders, they are severe mental illness that have biological basis, and schizophrenia is the most steady. Schizophrenia affected different area of a daily function. It is prototype disorder among psychiatric disorders. Information on schizophrenia also will also apply to other psychiatric disorders. Psychiatric disorders are brain-based psychiatric conditions. They cause significant function impairment and financial burden. Key symptoms include hallucination, delusion, disorganized thinking and speech. Referral thinking is paranoia, ideation, suspicious, abnormal motor behavior of shaking and involuntary muscle movement. So the patient experiences those symptoms. These conditions have a strong genetic components. Schizophrenia causes significant disturbance in many areas of the function. It causes disturbance in cognition, perception, emotion, behavior, eye movement, socialization. Schizophrenia core symptoms is psychiatric disorder features include hallucination, delusion, disorganized speech, abnormal behavior, and negative symptoms, as we mentioned before. Biological basis, this regulation of a transmitters like the dopamine, glutamate, GABA, and serotonin are the underpinnings of psychiatric disorder. Genetic and environmental risk include genetic variability and environmental factors like perinatal toxicity and early infection increase the risk of developing schizophrenia when the person is older. So the early signs and diagnosis of the symptoms include cognitive declining and social withdrawal. Give me 1 second, they are testing the alarm. Early prognosis symptoms include the cognition declining and social withdrawal that is important for early intervention. So when the person sees the first symptoms or the family sees the first symptoms, if they look for treatment, the prognosis will be better. The recovery will be better. There will be no function lost for the person. So the person can keep their brain. Keep their brain, what I mean is the brain function. They can function normally if the symptom is treated or the disease is diagnosed earlier. Risk factors. Schizophrenia has a multi-factor causes with the psychiatric and neurological component. Genetic factors play a significant role with 1% general population risk increasing to 50% of monologic twins. So that means it increases. Study shows twins who has one of the twins has schizophrenia. The other twin will have a 50% of increased risk. No significant gene identified believed to be involved with polygenetic defects. So there is no specific genes that identify, but the study shows there is a multiple genetic involvement. Neurodevelopmental issues include abnormal neural development and intertracheal insult, like toxicity and mother health. So if the fetus exposed to drugs, alcohol, infection, that can hinder the brain development and affect the health of the fetus, that can increase the risk of the baby developing schizophrenia. That is what the study shows. Brain structure abnormality in schizophrenia include large ventricles, small lobes, cortex atrophy, alter neural communication involve excessive dopamine in the mesolinic pathway and decrease the levels in others, along with change in the glutamate, GABA, and serotonin. Higher incidence of schizophrenia is in urban-born child, first-born individual, those from low socioeconomic background, babies born in winter and or spring. So if the family are going through stress, if they are poor, worry about money, worry about shelter, healthy, so stress in the family and the mother or what mothers eat can affect the baby development, and that can increase the risk of developing schizophrenia later in life. Schizophrenia occurs less frequently in women than men. Man onset is 18 to 25 years old, associated with more negative symptoms, poor prognosis, increased hospitalization, less medical responsiveness. Female onset is 25 to 35 years, typically less morbid dysfunction, more dysphoria, and tended to experience more paranoia, delusion, and hallucination. Early onset tended to occur in men, correlating with poor function, structural brain abnormality, negative symptoms, cognitive impairment, and worse prognosis. So men get schizophrenia worse. That, that means they cannot function normally, or their prognosis or controlling the symptoms. There's no treatment, as I said, but is controlling the symptoms and functioning as a normal society in the society. Man has a worse and women has a less. Okay, later onset tended to occur in women, correlating with few structural abnormality and less cognitive impairment and better prognosis. So if there is a few structural abnormality in the brain, that means there is less damage to the brain that leads to more cognitive functioning and better prognosis. But if there is a more structural abnormality in the brain, that means there is a damage to the brain. And when there is a damage to the brain happens, there will be cognitive impairment, more cognitive impairment and less prognosis, less to function in the society, less to have normal life. Schizophrenia. Symptom category of schizophrenia include positive, negative cognitive symptoms that persist for minimum of 6 months. Diagnosis requires 2 symptoms that include hallucination, delusion, disorganized speech or thoughts with functional impairment. So the person has to have one of these symptoms to be diagnosed schizophrenic. Two of these symptoms has to be seen. They have to have hallucination, delusion, disorganized thoughts or speech. It has to be 2 of them, and they have to have functional impairment. Functional impairment means they cannot work, they cannot study, they are having a withdrawal from the society. So those are the diagnosis criteria. Okay. Common findings include neurobiological findings include enlarged ventricles, cortical atrophy, reduced frontal lobe, temporal lobe volume, and connective tissue. So in the brain, frontal lobe and temporal lobe are very important. Frontal lobe is where the judgment and reasoning comes from. Temporal lobe is where the speech and language are located. Some of the language are located. So if that damaged, it's very hard to have normal function. Risky factors and prognosis. Genetic and environmental factors influence disease prognosis, disease progression, and prognosis vary with support and treatment engagement. Person who has schizophrenia, most of them, they may not engage treatment because they have that suspicious and they have in a delusional if they don't have a support system. There are many causes and risk factors for schizophrenia. Genetic risk factor, as we mentioned, has a higher schizophrenia have a higher heritability involving multiple genes variation that increases vulnerability to the disorder. Neurodevelopmental disruption. Early brain developmental disruption is linked to preneural exposure that increases susceptibility to schizophrenia later in life. So if the child have damage, if the brain of the child have a damage caused by alcohol, drugs, disease, lack of oxygen, lack of nutrition, that will be the risk factor of getting schizophrenia later in life. Neurobiological abnormality include dopamine dysregulation, neurotransmitter imbalance contribute to the schizophrenia symptoms, and cognitive deficits. Environmental contributions. Factors linked to urban breath, stress in the family or the baby, substance abuse, socioeconomic disadvantage raises schizophrenia risks. Prevention. Focus on at-risk family education for early intervention. So that means educate the family, educate the community about you will educate the family about the risk factors and what the symptoms to look for and the resources to find. And the community, you will educate about the stigma. You want to reduce the stigma so they can look for resources, so they can be supportive to the patient and recognize the signs and symptoms of the illness for potential treatment. You want to educate the family and the community that they can look for treatment and they can recognize or try to recognize the symptoms of the illness. And if they see that, they should look for treatment sooner so the patient can keep their normal function intact. Early recognition and intervention are crucial due to length of prodromal phase. Screening. Mild symptoms may include odd or unusual belief, feeling of being unliked, odd speech pattern, digression, and tangential, overly concrete or abstract thinking, collecting odd and worthless atoms, talking to themselves and isolating themselves. I have seen persons, not one thing, but I've seen many different persons who are in the hospital and they isolate themselves because they want to talk to family member, maybe their mother or father or girlfriend, and they are talking in their rooms. And when you enter the room so you can assist them or give them medication, they will be yelling and saying, "Why are you entering here? I am talking to my mother, I'm talking to my father, I'm talking to somebody, and they are here. And we have a conversation here. You shouldn't be entering here." Okay. And they literally think that person is with them. They see them visually, hallucination, and they can feel it, they can see it, and they can hear it. So they are hallucinating. So they want to have that privacy with that person. Some of them, they are scared of outside world, so they isolate themselves because paranoia shows that somebody is, those people are against you, so you have to be by yourself. So this is the worst disease of mental disorder. Assessment for regarding schizophrenia, no single pathognomonic symptoms. Rather, is a constellation of a symptoms. The illness impacts information process, leading to behavior and cognitive symptoms. So it's hard for them to process the information. Thus, they will have behavior because they can't understand what's going on or what is happening, and cognitive symptoms associate with a significant that is associated with significant social and occupational dysfunction. Dysfunction affected daily living include interpersonal relationship, social and occupational function, lower academic achievement compared to their siblings, job retention is difficult, and unemployed. Clinical presentation, self-care deficit. They have a poor hygiene, hard for them to manage financially, limit independence. Characteristic of a symptoms cluster include the negative, as we mentioned earlier, negative, positive, and associate symptoms. So DSM-5 diagnostic criteria of schizophrenia include it has to be 2 or more symptoms for 1 month, including at least one of these symptoms of delusion, hallucination, disorganized thought. Delusion, cluster, and disorganized types, thought withdrawal, and thought insertion. Symptom evaluation. Schizophrenia cluster assessment covers, as we mentioned before, positive, negative, cognitive, affect, symptoms, each impact, diagnosis, and treatment. Mental status and neurological signs evaluation includes mental status exam that reveals impaired insight, blurry affect, blunt affect, neurological soft sign. So that is the exam mental health professionally use to assess the patient impairment, mental impairment, and affected of schizophrenia, or if they suspected of schizophrenia being the disease. Diagnostic differential criteria. There is a differential diagnosis criteria to rule out mood or substance-induced or cognitive or seizure or endocrine autoimmune disease infection causes. So those diagnosis differential, they have some common with schizophrenia, but you want to rule that out. So those are the differential diagnosis. Standardized rating and functional evaluation. Use of rating scale and functional assessment to qualify symptoms and evaluate the impact on daily life. Psychiatric comorbidities include cardiometabolic disorder, which are a high of the metabolic disorder, diabetic, hypertension, dyslipidemia. These shorten life expectancy in schizophrenia patient. Nicotine dependency impact also. Up to 90% of the individual with schizophrenia use tobacco, affecting medical efficiency and healthy outcome. Psychiatric comorbidity include anxiety disorder. So patients with schizophrenia also have anxiety. That's why they want to withdraw from the society. They use substance to cope with abnormal, what they feeling. They have a OCD, those complicated treatment and worsen the symptoms of the schizophrenia. They have a high suicidal rate, with the risk factor include the age, the gender, the depression symptoms they feel, and if they use substance. Assessment. Hallucinations are the biased and unorganized, often improper, disorganized speech, closely disorganized behavior are present. Negative symptoms are evident and typically lead to significant social and occupational dysfunction. Negative symptoms include social withdrawal, low appetite, poor hygiene, so less than the normal function. Symptoms must last for at least 6 months to be schizophrenia. The course of the illness is varied. Some have stable courses, while the others experience episode, remission, and exacerbation. Negative symptoms usually appear first and tended to be more deliberate, while a positive may decrease over time. Risk factors. As we mentioned before, risk factors predict good prognosis. High pre-morbid functions, acute onset, later age of the onset, clear precipitation events, being unmarried or partner without partner. Being married will help you. Having a partner will help you. Good support system will help you. Presentation of a positive also will help you. Will help with the prognosis and treatment effectiveness, so you can have a normal function. Short interval between the treatment and the first symptoms also will help with the prognosis. That's why you want to educate the family and the community so they can seek treatment when they see the first symptoms. Absence of a structural brain abnormality has a good prognosis. Family history of mood disorder, but not family history of a schizophrenia. Negative predictive factors include sooner treatment correlate with better prognosis. Long entry pre-morbid period leads to poor prognosis. Subtype identification has limited value in prognosis and treatment. Physical examination findings include abnormal mood, as we talked about before, abnormal eye movement, poor eye-hand and coordination, presence of a neurological non-focal soft sinus, difficulty judgment, objective from by touch, twitch, rapid eye movement, eye blinking. This difficulty with rapid alternation movement, impair fine motor, left-right confusion, mirror. So all these are the physical findings of a person with schizophrenia. Mental health status examination findings. Eye movement, abnormal smooth pursuit, abnormal saccade movement, poor eye-hand coordination, client described as a clumsy, appear odd, unusual, peculiar. Speech is disorganized, loose association. Affect is blunt, flat affect, inappropriate. Mood is a bluntness, impoverished. That is what you see. That's what you find when you do the mental status exam. That's what you find a person with schizophrenia. Thoughts are psychotic, hallucination, delusion. They have a thought, they have referent. Thought control is insertion withdrawal. They have psychiatric contact potential impairment, impoverished. Cognitive is illogical, disorganized. Usually impact orientation, possible short-term memory, impair concentration, acute episode, create thinking on formal testing, impair judgment regarding self-welfare. Diagnostic and laboratory finding. No significant diagnostic lab finding exists. Structural studies show enlarged, as we mentioned, enlarged ventricles with cortical cells, decreased volume of white and gray matter, including the temporal lobe, hippocampus, amygdala, thalamus. Functional study reveal hypofrontal light, decrease in cerebral blood flow and metabolism difficulty, hypometabolic, low metabolic action is in a cortical, subcortical circuits. Differential diagnoses include epilepsy, central nervous system neuroplasm, HIV, acute intermediate porphyria, vitamin B12 deficit, heavily metal poison, Hutchinson disease, neurocephalus. People, this is the diagnostic differential that have some close symptoms of this schizophrenia. Psychiatric disorders that have some common with schizophrenia include bipolar affective disorder, substance-induced, and psychiatric disorders include hallucination, alcohol withdrawal. So those are they have some symptoms that mimic schizophrenia. Assess acute level during the acute psychiatric episode. Brief hospitalization may be needed. For patient safety and rapid stabilization of the symptoms, monitor the treatment adherence for stabilization and recovery. So it's needed for hospitalization if the patient safety is at risk, if the symptoms need to be stabilized, if you wanted monitor the treatment adherence. Some patients, when they discharge from the hospital, they may not take their medication. Because they either suspicious of the medication and treatment plan, or they cannot do it because their daily function is lower. So, but the non-acute episodes are typically managed in the community setting. Schizophrenia management. Assess for acute level. During the acute psychotic episode, client may require a brief hospitalization to ensure the client's safety by rapidly stabilizing client's symptoms level in controlled environment. Monitor the treatment adhesiveness with the goal of stabilizing the patient and the recovery. So the reason you want to hospitalize the patient, or if you are general practice, you want to refer them to the hospital, is they have to be hospitalized to monitor their treatment. You will give them the medication. You will make sure that they took the medication in the hospital. Sometimes the court will order them to be in hospital. They will be on court hold for their safety and for their recovery. Associated disorders include schizophrenia disorder, schizoaffective disorder, delusion disorder, brief or shared psychiatric disorder, management and relapse prevention, comprehensive care coordination, routine monitoring and testing, relapse and crisis prevention, patient family education. Those are the management and relapse preventions. So comprehensive care coordination, effective management requires collaboration between the clinician, social service, community program to support the patient. Routine monitor and testing require metabolic labs, CBC, organ dysfunction testing, ophthalmic exam, deficit medication-related effects early, relapse and crisis prevention, identifying the early warning signs and crisis planning enables timely intervention and reduces hospitalization. Patient and family education, educate patients and the family, improves the symptoms, recognition, medication adhesiveness, and engagement in cares. For summary, schizophrenia and other psychiatric disorders are serious mental illness with biological origin. Symptoms include hallucination, delusion, disorganized thinking, abnormal movement, negative symptoms. The disorganized affects cognitive processes, perception, emotion, social interaction, behavior, with gender differential in onset of patterns. Risk factors include genetic vulnerability, neurodevelopmental issue, neurotransmitter dysregulation, urban born stress in the child or the family, substance usage. Assessment involves evaluating various symptoms, ruling out other conditions. Individuals often have comorbidity like cardiometabolic disorders, nicotine dependency, anxiety, substance use. Management focus on early intervention, hospitalization during acute episode, comprehensive care, metabolic health monitoring, and relapse prevention strategy. Thank you for joining me today, and I would love to see you in my next video, which I will talk about schizophrenia medications. Look for that video. Thank you.